So, if you are okay with being audio taped, would you mind please just saying yes?
Yes.
Perfect. Okay. Now I'm going to ask you to just let me know what your unique ID is.
BLA0830.
So B as in boy?
Mm-hmm.
Okay. Thank you again. And I'm going to start off just because we want to know a little bit about the group of students we're interviewing. And obviously you will never be identified by yourself. It would just be students said, or field instructors said as a group report. But to describe our students, could you tell me your age, how you identify racially or ethnically, and how you identify in terms of gender?
Okay. 26, white Caucasian female.
Great. Okay. So I am really interested in your field placements, and if you could tell me the type of population you worked with in your field placement and some of their problems, presenting problems.
Mm-hmm. I was working with adults with chronic severe mental illness who had Medicaid, Medicare, and majority was MDD, schizophrenia, bipolar, anxiety were the main presenting problems.
Okay. Are these, you said adults?
Yes.
So 18 through whatever age?
Yeah.
Is this, what kind of setting? Outpatient?
Outpatient, yeah, outpatient clinic.
Okay. So they are maybe coming to you, being referred after discharge, maybe from inpatient?
Mm-hmm. Yeah, we got referrals from inpatient and then just doctors' offices as well, like primary care doctors.
Okay. So I guess the next part I want to ask you a little bit about is when you see these folks, do you do an intake, or they already have someone who did an intake assessment, biopsychosocial?
So for patients who have already been at the clinic that I took on my caseload, I didn't do an intake, but for all the new patients, I did do intakes.
All right. So this is what we're interested in. You obviously got trained way back when you first started in SPERT, and I'm kind of curious, what kind of questions did one ask at your agency in terms of intake about substance use?
So we asked if they smoked, drank, used drugs, and then we would ask more in detail when they first started using, how often they used, what was the most that they ever used, what's their frequency of use now, and then we also ask about substance abuse treatment, if they'd ever received treatment in the past or had any legal issues from their use in the past.
Okay, so I'm wondering, are these questions specific to your clinic? That was, sometimes some agencies are required to use certain screening tools based upon their, their agency setting or based upon their whatever funding sources. So I'm wondering if these questions were standardized, a specific screening tool, or...
If it wasn't a specific screening tool, just questions that the clinic came up with for their intake.
Okay. Would it have been, welcomed, I guess, or accepted if you had wanted to maybe bring in some questions from the SPERT training?
I think it would have been debated. Since our intake slots are so, they're not long enough usually, so I don't know if people would have wanted to have even more questions or screening tools to use during the intake.
Okay. So given time, you're saying the time constraints, it really had to be fast.
Yeah.
Yet, I didn't do the training, so forgive me if I'm not remembering correctly, but I think the ESPER, pre-screen basically were 3 questions, which are sort of like some of what you described, do you drink, do you smoke, and then you would go more in depth, like you said. So I'm not sure if the questions would have been that different. Yeah, or different.
Yeah, that's true. That's true. I think it would be nice, honestly, to have, because I feel like we ask about substance abuse, and then because with ESPER, you do the screening tools, and then you have the other brief screening stuff, and so I don't know if people would be willing to do the other stuff as opposed to just asking the questions. I don't know if they would be willing to do the brief intervention part during the intake. Right.
Well, I mean, and it may be that your setting's not really appropriate for the brief intervention, because they're usually probably coming from more intensive intervention, so you're not referring them to someplace else. I mean, they're already there, right? You would have referred them to you. But I guess I was just, and so ESPER is, used in different settings, and that's why I was so interested in talking to different students in different settings. But in your setting, it sounds like the screening could have been integrated, or at least adjusted to look at some of the questions that may be similar.
Yeah, I think so.
So I just I was wondering, like you said, if it was just something from so long ago that you just thought, oh yeah, this is very similar, or if it was hard bringing it up because everybody's so busy and people don't want to just even discuss adding questions, or I don't know.
Yeah, I think it's kind of the busy thing, and they're very resistant to change there, I've noticed.
And what examples can you give me, that might have, people try to bring up something and it didn't happen?
So the clinic had recently switched to Epic, the EMR system, and the way that they continue to do the scheduling is completely inefficient and borderline ridiculous, and people have brought up during staff meetings, Epic can be used in a much more streamlined fashion so that it's not this time-consuming and cumbersome, and the mistakes won't be made that are being made, and they're still oh no, we'll keep talking about it. We're not sure if we want to make that change, so it's something could obviously improve their efficiency, and they're still very resistant to it because this is the way they've always done it.
Yeah, it almost sounds like there's actually a new system implemented, but people are still trying to use the old system, and that in turn is clashing with the new.
Yeah.
Right.
Yep.
Okay. That's kind of interesting. Yeah. So I also wondered what would it have been like for an intern to have brought up, or recommended a change?
At my field placement, it wouldn't be they wouldn't dismiss me. They were very good at integrating me into the actual team and making me, just as much of a part of the team as all of the employees. So I think that they would have welcomed hearing the suggestion. I don't know if they would have, implemented any changes, but they wouldn't have dismissed me.
Okay, so it wasn't that you didn't bring it up because you felt as an intern it would not have been appropriate or appreciated.
Right.
So I guess I'm wondering, the people have talked about the timing of the training. And so I wondered if it was even something that, since you had taken so many more courses in between the year starting this field placement, whether or not it was even something that you had thought much about.
Honestly, not really, because, we took it our fall semester of our first year, and then it kind of never really got reinforced, I guess.
Yeah.
So it was hard to keep it on the forefront of my mind.
Right. Okay. So it sort of was something you taught, and we teach social workers about, all these different tools that you can have in your toolkit, and it was just one of those that was in your toolkit, but not really thought about to specifically use.
Yeah.
So, I'm kind of curious now, like if you still had the little flip book with all the questions, how different they would be from what your agency's questions were.
Probably not that different, honestly.
So it could have been something that if you had thought about, you could have said, hey, I can ask this question or ask this question, in this particular way.
Mhm. Yeah, probably. I think so.
Okay. So I guess I'm wondering if the other parts of the expert training, like you said, the referral part may not have been appropriate for your setting. The screening part could have possibly been used, and I'm wondering what about kind of the motivational interviewing part? Was that? Yeah.
I think most people in the clinic use motivational interviewing throughout their sessions, so I think that part would have been is used, even if it's not technically part of the expert. We still all do the motivational interviewing.
So was that something you first got exposed to in the expert training? And yeah.
Yeah, it was. And then almost every advanced class I had this year brought it up as well, which was kind of annoying because I had to sit through like 5 different lectures on motivational interviewing. But yeah, expert was the first time I was exposed to it.
Okay. So in some ways, you had a lot of it over and over again, but it definitely was something that got reinforced over and over again.
Yeah.
Okay. So that's interesting to hear because, not only does your agency use it, but classroom was teaching it.
Mm-hmm.
And I wonder what it would have been like if expert had been reinforced over and over again.
Yeah.
So expert never showed up in any of the advanced courses?
It would be like, it would be mentioned. So I'm in a addictions class right now, and it was mentioned as, a tool to be used, but we didn't really go in depth with it at all.
Okay. So it was just, here's another possible, tool to use or an approach.
Right, yeah.
Okay. I guess I was wondering if you had to put expert, the training, somewhere in your educational career in these 2 years, where would you think it might be better, and or if it was going to be kind of taught or kind of re-exposure, where would you put it?
think doing it in the first semester is still good because people can use it in their, foundation year field placement, but I think having a re-exposure again at the beginning of the second year would have been nice.
Where would any specific class in the second year?
That one's hard since people usually split off. We don't have like the classes we have to take.
Yeah,
I think it would have been. Yeah, I think it would have been nice in my addictions class this year.
Okay. Yeah.
To have re-exposure to it there because it would be relevant to the class.
Yeah. No, that's why I think the trainers were struggling where to have the training, and that's how it ended up in 6:30, even though not a lot of people were specifically working with addictions. This brings up a good question. Did you have an opportunity in your first year placement to use Esprit?
I didn't. I was in an elementary middle school, so we didn't really do much drug screening, for at least I didn't really have a lot of middle schoolers on my caseload. I had a lot of the elementary schoolers, so we didn't really use any drug or alcohol screenings on them.
Oh, okay. Do you know if they start doing drug and alcohol screenings in middle school?
We didn't have any specific protocol. If we suspected someone might be on drugs, then we would talk to them about it, but there wasn't any specific screening.
Okay, so nothing universal like everybody in 8th grade gets asked.
Nothing universal.
Okay, ask these questions. I wonder if that's something that you feel should be done at a certain age.
I would say definitely in high school. Maybe it was so far and few between with the middle schoolers. I feel like it would be, at least at my school, it was far and few between.
Okay.
With the middle schoolers, so I think it would have been a bit aggressive.
Okay.
But I mean, is that a bad thing?
No, I was just saying in that sense, like they would have felt, kind of like being suspected of things. Yeah. So, kind of back to the training, if I may. If you remember, I know it's a while ago, you had like an online module that you had to do on your own.
Yes.
And then you had a 3-hour class. So, do you remember what you liked about it and what you didn't?
If I remember correctly, I think I found the online module and then the class to be, it seemed like the class was just repeating what the online module said.
Okay.
I appreciated the class time because we got to practice with the screening tools and that kind of stuff, but as far as the information given about Esprit, it seemed to be a bit repetitive.
Okay. So instead of taking the time in the classroom to maybe go over again what was already, posted online, what would you have liked to see more of?
Probably it would have been nice to see more role plays to see how people kind of used Esprit naturally and kind of made it flow in the process instead of, because that's just something overall in the program where we learn all these interventions, but we never learn how to use them in a natural, fluid way that doesn't seem like we're just pulling stuff out of our butts.
Okay. So it's, yeah, no, I appreciate that. So it's like a lot of, you know, people sometimes love role plays and people sometimes hate role plays, but, you know, role plays somewhat make you practice, but it's not, like you're saying, necessarily kind of natural in terms of the setting.
Yeah.
So more practice would have been helpful.
Yeah.
And then I'm hearing you say something about maybe, I guess, the fluidness and the organicness. Is that having to do with how to apply it in a setting?
Yeah, like how to apply it. Like if I'm doing an intake, is there, instead of just saying, okay, now we're going to do these brief interventions, just kind of like organically bringing it up, or if I'm not doing an intake and it's just a regular session and I think it's something that needs to be done, like how to kind of organically incorporate it into the session instead of just pulling it out of my desk drawer and saying we're going to do it.
Right, so kind of how to segue it. If you're talking to someone in a session, you're thinking maybe there's a problem, how to, you know, kind of get into that without saying, oh, excuse me, let me pull out these questions, let me ask you.
Yeah.
Okay, I just want to make sure I understood. I'm sorry, were you going to say something?
Oh, no.
Okay. So was the length of the training, I mean, what did you think about the length?
I mean, it was just a normal class period, so
It was.
I don't like the 3 hours to begin with, but that's just me because I have a very short attention span.
Okay.
But I mean, it was just like a normal class session, so it wasn't like cumbersome.
Okay. Yeah. That's all good to know. Yeah, I guess I don't know if other schools have these 3-hour classes, but that's what Maryland seems to have.
Yeah. When I realized that, I was like, are you kidding me? How am I supposed to pay attention for 3 hours?
Right. I know. So then this is all really, really helpful and interesting to know. And I guess I'm trying to figure out if, since you get lots of people with lots of different problems coming in, some of whom do have substance issues, so kind of dual diagnosed. Do you think SBIRT is something that the staff is aware of?
If they are aware of it, then they have never mentioned it.
Okay.
I don't know. I don't think so, but I think that they'll be willing to learn if it got them CEUs.
Okay.
I pick that up. They're very willing to do anything for a CEU.
Okay. So it's not something your field instructor kind of mentioned or would have brought up. Okay.
No.
I wonder if your field instructor got the CEU, because we actually train field instructors. So can you tell me, is everyone, well, what is the composition of the staff? Is it multidisciplinary?
Yeah, we have the social workers, and then we also have a psychiatric RN, and then there are psychiatrists and residents and fellows.
Okay. So it's pretty mixed, and what you're saying is, well, who is it? Only the social workers who do the intake? When?
No, the residents also do intakes.
Okay. So, but the intake is the same. The form is the same for everybody.
Right.
Okay. Because I was wondering, I mean, residents, the medical residents at some point, depending on what year they were, got kind of SBIRT too. So I was wondering, did it ever come up or not? But okay. So it's multidisciplinary. People follow the questions pretty much from the agency set kind of intake form.
Yeah.
Okay. Anything else that you think I need to know? Is Esprit something that you would kind of pull out in your future?
I think, yeah, depending on the setting that I'm at, if it, is appropriate for the population, I think definitely.
Okay, so you would use it kind of to help you, guide you.
Yeah.
Okay. Well, like I said, is there anything that you think you might want to tell me that I haven't asked?
I don't think so. I can't think of anything.
Okay, so let me stop taping, and then I will kind of wrap this up with you.
Okay.